Every week at least 12 young people die of undiagnosed heart conditions.
Toshiba Medical Systems, Manchester United, University of Exeter, Bristol Heart Institute and Crick have joined forces to help reduce the number through a research project and improve the lives of children with heart disease.
This research project is the first of its kind, as it will monitor children's hearts while exercising and not at rest, and this will be using a Toshiba ultrasound scanner. Toshiba's heritage in applied research and development means that we have developed the technological ability to be an important partner in research of this kind.
The research project is completely different from any other screening process that has been done in the football arena. Our players are aged from 14 to 16 years old, so I think if we can provide reassurance to parents as well as the players, I think that is clearly a good thing for the health of our players, but also for the health of the nation.
Identifying the benefits and limits of exercise on young people's hearts will benefit all of us.
1 in 100 children are born with a heart condition, and although our surgical colleagues have done a lot over the last decades to help most of these children to survive into adulthood, these little patients still have and need lifelong care and encounter a lot of problems.
Compared to adults, we know considerably less about children's fitness and activity. For example, we know that healthy children, adolescents, are recommended to do at least 1 hour of moderate to vigorous physical activity per day. We also know that the vast majority, over 90%, do not meet these recommendations.
Our research hopes to address several questions. One is to find the right amount and the right type of exercise for children with congenital heart disease, and eventually create training programs. Secondly, we also would like to understand better how our heart works during exercise. And thirdly, it is also important that our research tries to explore and hopefully develop training protocols, but also screening protocols for young athletes.
One of the key and novel features of this research with all the partners is that we are putting together these fitness measurements through the oxygen uptake analyzers and the echo together, so that when we exercise these young boys, we can see how their function is taking place in a very dynamic setting. So this is very different to the normal practice where these measurements are normally just taken at rest. So we believe that by having the boys exercising, we can potentially see dysfunction much earlier than we would normally see if we just took these measurements at rest.
And to do all this, we have teamed up with specialists from other universities, and we have involved both the University of Bristol and the University of Exeter, but also Manchester United Football Club and Toshiba Medical Systems.
As part of our commitment to improving health for people, research that enables better early detection and is proactive and precautionary is hugely motivational for Toshiba Medical Systems and our partners Manchester United, the University of Exeter and Bristol Heart Institute and Crick.
This research project will tell us more about how young hearts cope with sport. It should help people exercise safely and could help to prevent such sudden and tragic deaths.